What are the essential steps to ensure patient confidentiality when handling medical images and records in compliance with HIPAA regulations? Answer: to ensure patient confidentiality, the following steps must be taken. Secure storage of medical images and records. Medical records, including diagnostic images, must be stored in secure electronic systems with access restricted only to authorized personnel. This can be achieved through encryption and secure passwords. Limited access. Ensure that only medical staff directly involved in the patient's care have access to their records. Unauthorized individuals should not view patient information under any circumstances. Transmission of data. When transmitting medical images and patient data, e.g., to another healthcare provider, ensure that encryption protocols are in place to protect sensitive information. Patient consent. Obtain informed consent from the patient for the sharing of their medical information, especially when dealing with third-party providers or specialists. HIPAA training. All staff members must undergo HIPAA training to understand their legal responsibilities regarding the protection of patient information and the consequences of non-compliance. What is the appropriate protocol for dealing with a patient who has a known allergy to contrast media but requires a contrast-enhanced imaging procedure? Answer: the protocol for managing a patient with a known contrast media allergy includes pre-procedure consultation. Obtain a detailed medical history focusing on any prior allergic reactions to contrast media. The radiologist and medical team should be made aware of the patient's allergy. Alternative imaging methods. If possible, consider alternative imaging techniques that do not require contrast media, e.g., MRI instead of CT for certain diagnostic purposes. Premedication. If the imaging procedure with contrast media is absolutely necessary, the patient may be premedicated with antihistamines, e.g., diphenhydramine and corticosteroids, e.g., prednisone, to minimize allergic reactions. Use of low-osmolar or non-ionic contrast. Use of a low-osmolar or non-ionic contrast media may reduce the likelihood of an allergic reaction. Emergency preparedness. Ensure that emergency medications such as epinephrine and oxygen are readily available during the procedure in case of an anaphylactic reaction. Relevant law guideline. The American College of Radiology (ACA) provides guidelines on managing contrast media reactions, emphasizing patient safety and the importance of detailed medical histories. Mrs. Anderson, a 65-year-old woman, requires a CT scan with contrast media. She informs the technician that she is diabetic and takes metformin daily. What precautions should the radiology team take in this case? Answer: in patients taking metformin, contrast media administration requires special precautions due to the risk of lactic acidosis, especially in cases of impaired renal function. Assessment of renal function. Before administering contrast media, the patient's renal function should be assessed via blood test, e.g., serum creatinine or estimated glomerular filtration rate (EGFR). If renal function is impaired, the use of contrast media should be reconsidered. Metformin discontinuation. Based on the American College of Radiology (ACA) guidelines, metformin should typically be discontinued at the time of contrast administration and withheld for 48 hours afterward. Renal function should be reassessed before resuming metformin. Monitoring post-procedure. The patient should be monitored for any signs of lactic acidosis post-procedure, particularly if there is evidence of impaired renal function. Hydration. Encourage the patient to stay well hydrated before and after the procedure to aid in the excretion of the contrast media. Describe the appropriate emergency procedure if a patient experiences an anaphylactic reaction to contrast media during an imaging exam. Answer: in the event of an anaphylactic reaction to contrast media, the following emergency procedures should be followed. Immediate discontinuation. Stop the contrast media administration immediately upon noticing signs of anaphylaxis, e.g., difficulty breathing, swelling, hypotension. Administer epinephrine. Administer intramuscular epinephrine as the first-line treatment for anaphylaxis. The standard dose is 0.3 mg of 1,000 epinephrine. Airway and oxygen support. Ensure the patient has a clear airway and provide oxygen therapy. In severe cases, intubation may be necessary to maintain the airway. Fluid resuscitation. Administer intravenous fluids, e.g., saline, to combat hypotension and prevent shock. Antihistamines and corticosteroids. After epinephrine, consider administering antihistamines, e.g., diphenhydramine and corticosteroids, e.g., hydrocortisone, to help reduce the allergic response. Monitoring and transfer. Continue to monitor the patient's vital signs closely and prepare for immediate transfer to an emergency department if symptoms do not resolve. What verbal and nonverbal communication techniques can a radiologic technologist use to improve the patient experience during an MRI exam, especially for patients experiencing anxiety? Answer: effective communication is crucial to alleviating patient anxiety during an MRI. Techniques include verbal communication, reassurance, verbally reassure the patient about the safety and purpose of the MRI procedure, explain the process in simple terms and answer any questions the patient may have. Clear instructions, provide clear, step-by-step instructions on what the patient can expect during the scan. Noise from the machine, duration of the procedure, nonverbal communication, body language, use open and calm body language, standing close to the patient, maintaining eye contact and nodding can help convey empathy and understanding. Touch, gentle touch on the shoulder or arm, if appropriate and comfortable for the patient, can provide reassurance without the need for words. Comfort measures, offer the patient earplugs or music to minimize discomfort from the noise, explain the use of the panic button and ensure the patient knows they can communicate with the technician at any time during the scan. What are the necessary steps in obtaining informed consent before administering a contrast-enhanced imaging procedure? Answer: to obtain informed consent, the following steps are required. Explain the procedure. Provide the patient with a clear explanation of the imaging procedure, including why the contrast media is necessary and what the patient can expect, risks and benefits. Discuss potential risks associated with the procedure, e.g., allergic reactions to contrast media, potential side effects, and the benefits, e.g., improved diagnostic accuracy, alternative options. Explain any alternative imaging methods available that do not require contrast media if applicable. Answer questions. Allow the patient to ask any questions and ensure they fully understand the information provided. Document consent. Once the patient consents, document this in their medical records. The patient should also sign a written consent form. Relevant law guideline. Informed consent is a legal requirement based on patient rights and medical ethics. Radiologic technologists must follow institutional protocols and ensure that consent is properly documented before proceeding. Mr. Williams, a 45-year-old patient, arrives for a fluoroscopy exam but is visibly anxious and claustrophobic. What steps should the radiologic technologist take to manage his anxiety during the procedure? Answer: to manage Mr. Williams' anxiety and claustrophobia during the fluoroscopy exam. Pre-procedure conversation. Engage in a calm, reassuring conversation to help reduce anxiety. Explain the procedure step by step and emphasize that the patient can communicate throughout the process. Distraction techniques. Offer music or encourage Mr. Williams to focus on deep breathing exercises to calm himself during the procedure. Shorter sessions. If feasible, offer to break the exam into shorter intervals, allowing the patient time to relax between scans. Positioning support. Ensure that Mr. Williams is in the most comfortable position possible and provide pillows or supports to enhance comfort. Use of mild sedation. If the anxiety is severe, consult the supervising physician about the possibility of administering mild sedation with the patient's consent. Relevant guideline. Radiology departments should follow established patient care protocols to address anxiety. What are the potential risks associated with repeated exposure to ionizing radiation in diagnostic imaging, and how can technologists mitigate these risks? Answer: repeated exposure to ionizing radiation can lead to several potential risks, including increased cancer risk. Cumulative exposure to ionizing radiation is associated with a higher risk of developing cancers, particularly leukemia and thyroid cancer. Radiation burns. High doses or prolonged exposure may lead to skin burns and tissue damage, especially with repeated fluoroscopy or interventional procedures. Effects on the skin and gonads. Frequent imaging can cause skin changes such as erythema or telangiectasia and may impact fertility due to exposure to the gonads. To mitigate these risks, technologists should utilize ALARA principle. Follow the as low as reasonably achievable ALARA principle by minimizing radiation dose while ensuring image quality. Use shielding. Employ lead aprons, thyroid shields, and other protective equipment for both patients and staff to reduce exposure during procedures. Optimize protocols. Optimize imaging protocols to ensure that the lowest effective dose of radiation is used. Educate patients. Inform patients about the necessity of imaging procedures and discuss alternative options when appropriate to minimize unnecessary repeat exposures. What steps should be taken when a patient with a known history of renal impairment requires a contrast-enhanced imaging study? Answer: for patients with a known history of renal impairment requiring a contrast-enhanced imaging study, the following steps should be taken. Assessment of renal function. Evaluate the patient's renal function through laboratory tests such as serum creatinine levels and calculating the estimated glomerular filtration rate (EGFR). Consultation with radiologist. Discuss the patient's renal status with the radiologist to determine whether the benefits of the contrast-enhanced study outweigh the risks. Consider alternative imaging methods that do not require contrast. Hydration protocol. Ensure the patient is well hydrated before the procedure to help flush the contrast from the kidneys. Oral hydration may be sufficient, but intravenous hydration may be required in some cases. Premedication consideration. If the use of contrast is deemed necessary, consider premedicating with medications that may help reduce the risk of contrast-induced nephropathy, as advised by the radiologist. Post-procedure monitoring. Monitor the patient's renal function post-procedure, especially if there are concerns regarding their renal health. Follow-up lab tests may be necessary to assess any changes in kidney function. Relevant guideline. The American College of Radiology (ACA) and the Radiological Society of North America (SNAI) guidelines address the management of patients with renal impairment undergoing contrast-enhanced studies. What are the critical factors in patient positioning for a chest X-ray, and why are they important? Answer. Key factors in patient positioning for a chest X-ray include correct positioning. The patient should be positioned upright if possible, with their back against the image receptor and shoulders rolled forward. This positioning ensures that the heart and lungs are adequately visualized without distortion. Central ray alignment. The central ray must be aligned to the mid-sternum at the level of T, approximately 7 inches below the vertebra prominence, to capture a comprehensive view of the thoracic structures. Inspiration technique. Instruct the patient to take a deep breath in and hold it during exposure. Proper inspiration expands the lungs, allowing for clearer imaging and reducing motion blur. Minimize motion. Ensure the patient is instructed to remain still during exposure to avoid motion artifacts that can obscure diagnostic quality. Use of markers. Place appropriate markers, e.g., left or right, on the image to indicate laterality, which is crucial for accurate interpretation by the radiologist. Importance. Proper patient positioning is essential to obtain diagnostic quality images while minimizing the risk of repeat exposures, thus reducing overall radiation dose to the patient. Explain the function and importance of the anode and cathode within an X-ray tube. How does their interaction facilitate the production of X-rays? Answer. In an X-ray tube, the cathode consists of a heated filament that emits electrons via thermionic emission. These electrons are then accelerated toward the anode due to the potential difference voltage applied across the tube. The anode is typically made of a metal like tungsten, chosen for its high melting point and atomic number, which increases the efficiency of X-ray production. The interaction between the fast-moving electrons and the anode target produces X-rays through two primary mechanisms: Bremsstrahlung radiation, break-in radiation. As electrons are decelerated by the nucleus of the tungsten atoms, the change in kinetic energy is emitted as X-rays, characteristic radiation. Electrons from the cathode can knock inner shell electrons out of the tungsten atoms. When electrons from higher energy levels fall to fill the vacancies, X-rays are produced with energies characteristic of the target material. The anode also serves the crucial role of dissipating the significant amount of heat generated during X-ray production, often through rotating anodes or specialized cooling systems. Dr. Emily is working in a diagnostic imaging department that uses a high-frequency X-ray generator to capture images of patients with complex fractures. One day, the generator produces inconsistent image quality, and the exposure seems prolonged. Dr. Emily notices the generator's transformer may be malfunctioning. What steps should Dr. Emily take to troubleshoot and correct the issue, and how do transformers function within an X-ray circuit? Answer. Dr. Emily should start by checking the step-up transformer in the X-ray circuit, which is responsible for increasing the voltage to the levels required for electron acceleration. If this transformer is malfunctioning, the voltage may not be adequately supplied to the X-ray tube, resulting in suboptimal X-ray production and prolonged exposures. The step-up transformer operates on the principle of electromagnetic induction, where alternating current they see in the primary coil induces a higher voltage in the secondary coil. Issues could arise if there are faulty windings or if the power supply is unstable. Dr. Emily should verify the power input to the transformer, check for loose connections or damaged wiring in the transformer circuit, ensure the high-frequency generator is functioning properly, as the consistent high-frequency voltage supplied by the generator is crucial for rapid X-ray production. If the transformer or generator is faulty, it should be serviced or replaced to restore optimal imaging performance. Describe the principles of image intensification. How does it improve the quality of fluoroscopic imaging? Answer: image intensification is used in fluoroscopy to enhance the brightness of the real-time X-ray images, allowing for better visualization of dynamic processes within the body. The principle involves converting low-intensity X-rays that pass through the patient into a bright visible image. The process works as follows. X-rays strike a fluorescent screen typically made of cesium iodide, where they are converted into visible light. The light photons are then directed toward a photocathode, which emits electrons in response to the incoming light. These electrons are accelerated and focused by electrostatic lenses toward an output phosphor screen, where they are converted back into a visible image. The acceleration process amplifies the brightness of the image by a factor of thousands. This system allows for real-time imaging at much lower radiation doses compared to non-intensified systems. Modern fluoroscopy systems often use CCD, charge-coupled device, or flat-panel digital detectors, which further enhance image resolution and allow for digital storage and processing. What is multi-detector CT EDT, and how does it differ from single-slice CT scanners? Discuss the advantages of MD-CT in terms of image acquisition and reconstruction. Answer: multi-detector CT EDT systems use multiple rows of detectors to capture multiple slices of data simultaneously with each rotation of the X-ray tube, in contrast to older single-slice systems that could only capture one slice per rotation. This capability significantly enhances both the speed of image acquisition and the volume of data collected. The main advantages of MD-CT include faster scanning. With multiple detector rows, a larger area of the body can be imaged in a shorter time, reducing patient motion artifacts. Thinner slices. MD-CT allows for thinner slice collimation, leading to higher spatial resolution and more detailed images, particularly in the axial plane. Volumetric data. MD-CT systems can capture volumetric data, which enables better 3D reconstructions and improved visualization of complex anatomical structures. Image reconstruction techniques, such as iterative reconstruction and filter back projection, further enhance the quality of MD-CT images by improving contrast resolution and reducing noise. What are the primary components of a picture archiving and communication system, PACS, and how does it interact with the DICOM standard for medical imaging? Answer: a PACS system is designed to store, retrieve, distribute, and present medical images in a healthcare setting. Its primary components include imaging modalities, devices such as X-ray machines, CT scanners, and MRIs that generate medical images. Archive server. This central repository stores the vast quantities of image data in both short-term online storage and long-term offline storage systems. Workstations. Computers that allow healthcare providers to view, manipulate, and analyze images. Network infrastructure ensures that images can be transmitted efficiently between imaging modalities, archives, and workstations. PACS interacts with DICOM, Digital Imaging and Communications in Medicine standards, which define the formats for medical images and the communication protocols for transmitting those images across systems. DICOM ensures interoperability between different imaging devices and PACS, allowing seamless sharing and access to medical images across departments and institutions. Mr. Allen, a radiologic technologist, is performing a breast mammogram for a 45-year-old patient. During the procedure, the patient complains of discomfort due to breast compression. Mr. Allen explains that this is necessary for producing high-quality images. Why is compression critical in mammography, and how does it contribute to better image quality and patient safety? Answer: breast compression is critical in mammography for several reasons. Reduced thickness. Compression flattens the breast tissue, making it thinner. This reduces the amount of X-ray scatter, improving image contrast and reducing the radiation dose required to obtain a clear image. Minimized motion blur. Compression helps immobilize the breast, reducing the likelihood of motion blur during the exposure, which is essential for sharp, high-resolution images. Tissue separation. Compression helps separate overlapping breast tissues, which makes it easier to detect abnormalities such as microcalcifications or tumors. Low radiation dose. By reducing breast thickness, compression allows for a lower radiation dose while still achieving the necessary image quality. Despite discomfort, compression is essential to ensure both image quality and patient safety by minimizing radiation exposure. Learn the principles of Doppler ultrasound and how it is used to measure blood flow. What are the differences between color Doppler and spectral Doppler? Answer: Doppler ultrasound is based on the Doppler effect, where the frequency of the sound waves changes depending on the movement of the object, in this case blood cells. If blood cells are moving toward the transducer, the frequency of the returning ultrasound waves increases. If they are moving away, the frequency decreases. This shift in frequency is used to calculate the velocity and direction of blood flow. Color Doppler. This method assigns colors to the direction of blood flow, typically red for flow toward the transducer and blue for flow away. It provides a visual map of blood flow within vessels, helping to identify areas of abnormal flow. Spectral Doppler. This method provides a graphical representation of blood flow velocity over time, offering more detailed quantitative information about the speed and pattern of flow. It can differentiate between laminar and turbulent flow, which is essential for assessing vascular conditions. Both color and spectral Doppler are used to assess conditions like arterial stenosis, venous insufficiency, and cardiac abnormalities. Compare the different types of magnets used in MRI machines and discuss the safety considerations associated with MRI procedures. Answer: MRI machines utilize three main types of magnets. Superconducting magnets. These are the most commonly used magnets in MRI machines and provide the strongest magnetic fields, typically ranging from 1.5 Tesla T to 3.0 T and even higher in some advanced systems. Superconducting magnets require cooling with liquid helium to maintain their superconducting state, which allows for high magnetic field strength with minimal energy loss. Resistive magnets. Resistive magnets use electrical currents to generate magnetic fields. They are less powerful than superconducting magnets, usually providing fields up to 0.3 T. Although they are cheaper to purchase and operate, resistive magnets require continuous power supply, which can lead to higher operational costs in the long run. Permanent magnets. These magnets are made from magnetic materials. Permanent magnets are typically used in low-field MRI systems, which can provide fields around 0.1 to 0.5 T. They are advantageous for specific applications, such as open MRI systems, which can accommodate patients who may experience claustrophobia. Safety considerations. Magnetic field hazards. The strong magnetic fields generated by MRI machines can attract ferromagnetic objects, posing risks to patients and staff. Effective screening protocols must be implemented to prevent accidents. Implant safety. Patients with certain implants, such as pacemakers, cochlear implants, or specific metal prosthetics may be contraindicated for MRI due to potential interference with the magnetic field or the heating of the implant. Patient monitoring. Given the enclosed design of many MRI machines, patient comfort is essential. Monitoring for signs of anxiety or claustrophobia during the procedure is critical. Acoustic noise. MRI machines produce significant noise during scanning due to gradient switching. Patients should be provided with ear protection to prevent hearing damage. Describe the function of a gamma camera in nuclear medicine and the principles behind its operation. How does it differ from other imaging modalities? Answer: a gamma camera, also referred to as a scintillation camera, is a critical tool in nuclear medicine that enables the visualization of radioactive traces within the body. Its primary function is to detect gamma radiation emitted from the traces administered to patients and convert this radiation into images. Principles of operation. Collimator. This component allows only gamma rays traveling in specific directions to reach the detector, thus enhancing spatial resolution and reducing scatter radiation. Scintillation crystal. The camera utilizes a scintillation crystal, often made of sodium iodide, Ni, that absorbs incoming gamma rays and emits visible light scintillations as a response. Photomultiplier tubes (PMTS). These tubes detect the scintillations and amplify the light signal into an electrical signal that can be processed to form an image. Computer system. The electrical signals generated by the PMTS are processed to create two-dimensional images that represent the distribution of the radioactive tracer in the organ or tissue of interest. Differences from other imaging modalities. Unlike other imaging modalities such as X-ray, CT, or MRI, which primarily provide structural images of anatomy, nuclear medicine imaging focuses on the physiological function of tissues and organs. It allows for the assessment of metabolic processes, blood flow, and the detection of diseases such as cancer, thyroid disorders, and cardiac conditions by visualizing how radioactive traces behave in the body. What are the characteristics of specialized X-ray tubes used in mammography, and why are they essential for breast imaging? Answer: specialized X-ray tubes used in mammography are designed to optimize image quality while minimizing patient radiation exposure. Key characteristics include filtration. Mammography tubes utilize specific filtration, often aluminum, to selectively filter out low-energy X-rays that do not contribute to image quality, thereby enhancing the contrast between different breast tissues and reducing unnecessary radiation dose to the patient. Target material. Tungsten is commonly used as the target material due to its high atomic number and melting point, which allows for efficient X-ray production while minimizing heat damage to the tube. Low peak kilovoltage AVP. Mammography systems operate at lower kVp settings, typically 2.5–3.5 kVp, which improves the contrast of soft tissue and is particularly effective in imaging dense breast tissue, enabling better detection of small lesions. Compression mechanism. The specialized X-ray tubes are designed to work in conjunction with compression devices that flatten the breast tissue. Compression is crucial for reducing breast thickness, which improves image quality and reduces radiation exposure. What are the primary factors that influence image quality in medical imaging, and how do they interact with each other? Answer: image quality in medical imaging is influenced by several factors, including contrast resolution, spatial resolution, and noise. Contrast resolution. This refers to the system's ability to distinguish between differences in density or signal levels. Higher contrast resolution allows for the visualization of subtle differences in tissues, which is critical for accurate diagnosis. Spatial resolution. This indicates how well fine details are displayed in the image. It is primarily determined by the pixel size and the matrix size of the digital image. Smaller pixel sizes and larger matrices enhance spatial resolution. Quantum model. This is a type of noise that occurs due to the statistical nature of photon detection. It can significantly degrade image quality, especially in low-dose imaging. Interaction between factors. For instance, increasing the kilovoltage AVP can improve penetration and contrast resolution, but if set too high, it may reduce spatial resolution due to increased scatter. Additionally, an optimal balance of exposure factors, kVp, milliampere mar, and exposure time is crucial to maintain both contrast and spatial resolution without introducing excessive noise. Explain the effects of varying kilovoltage AVP on image density, contrast, and detail in radiography. Answer: kilovoltage AVP plays a significant role in determining the quality of radiographic images. Image density. Increasing kVp generally increases the overall image density because higher energy photons penetrate tissues more effectively, resulting in more photons reaching the detector. However, excessive kVp can lead to overexposure and loss of detail. Image contrast. The relationship between AVP and image contrast is critical. Higher kVp settings lead to lower contrast due to the increased number of penetrating photons, which reduces the difference between adjacent tissues. Conversely, low kVp enhances contrast, but may result in insufficient penetration of denser tissues, leading to underexposed images. Detail. While higher kVp can improve image density, it may reduce the visibility of fine details due to increased scatter radiation. The ideal kVp setting should balance penetration, contrast, and detail to achieve optimal image quality. Mr. Anderson, a radiologic technologist, is preparing to perform a chest X-ray on a patient with a history of lung disease. He is unsure whether to use a high kVp setting or a low one. Considering the patient's condition and the diagnostic goals, what should Mr. Anderson consider when deciding the appropriate K? Answer: in determining the appropriate kVp for Mr. Anderson's chest X-ray, he should consider the following. Patient condition. Given the patient's history of lung disease, using a higher kVp setting may be beneficial. Higher kVp will allow for better penetration through the thoracic structures, enabling the visualization of lung fields and any potential abnormalities. Diagnostic goals. If the goal is to assess the details of lung pathology, Mr. Anderson might want to use a lower kVp to enhance contrast and improve visualization of fine details. However, for general screening purposes, higher kVp can provide adequate density while minimizing radiation dose. Higher kVp settings allow for lower mass, which can reduce patient exposure. However, Mr. Anderson must balance this with the need for adequate contrast. Ultimately, Mr. Anderson should select that it provides sufficient penetration for the patient's specific anatomy while maintaining the necessary contrast for diagnostic accuracy. A typical range for chest X-rays is between 110 and 130 kVp, but this may need to be adjusted based on the patient's build and condition. Describe the role of histogram analysis in digital image processing and its impact on image quality. Answer: histogram analysis is a vital component of digital image processing that provides valuable insights into the distribution of pixel intensities in an image. Functionality. A histogram represents the frequency of occurrence of each pixel value intensity in the image. By analyzing the histogram, technologists can assess whether the image has the correct exposure, is underexposed, or is overexposed. Image quality improvement. Histogram equalization techniques can be employed to enhance image contrast by redistributing pixel intensities. This process can help to accentuate details that might be lost in regions of low contrast. Application in post-processing. In digital radiography, lookup tables, LUTs, can be applied based on histogram analysis to adjust the image contrast and brightness. By applying appropriate LUTs, the visibility of anatomical structures can be improved, ensuring diagnostic accuracy. By using histogram analysis, technologists can ensure optimal image quality, leading to better diagnostic outcomes. What are common artifacts encountered in medical imaging, and what troubleshooting techniques can be applied to resolve them? Answer: artifacts are unwanted features in medical images that can compromise diagnostic quality. Common artifacts include motion artifacts. Resulting from patient movement during image acquisition, these can cause blurring and streaking in the image. Grid misalignment. Misalignment of the imaging grid can lead to banding artifacts where areas of the image exhibit varying density. Detector issues. Problems with the imaging detector, such as pixel dropout or electronic noise, can create uniform areas in the image or lead to non-uniformity. Troubleshooting techniques. Motion artifacts. To reduce motion artifacts, the technologist should ensure the patient is adequately informed about remaining still during the exposure. Using shorter exposure times can also help minimize the effects of patient movement. Grid misalignment. Regular maintenance and calibration of the grid are crucial. Technologists should ensure that the grid is correctly positioned and aligned with the X-ray beam. Detector issues. Routine quality control checks should be implemented to identify and rectify detector issues. Discuss the significance of lookup tables, LUTs, in digital image processing and their influence on diagnostic accuracy. Answer: lookup tables, LUTs, are essential tools in digital image processing that influence the presentation of medical images. Definition: a LUT is a mathematical table that maps input pixel values to output pixel values, allowing for adjustments in image brightness and contrast. Influence on diagnostic accuracy. By applying LUTs, technologists can enhance the visibility of structures within the image. This is particularly important in radiology, where subtle differences in tissue density are crucial for diagnosis. An optimized LUT can help to bring out features that might otherwise go unnoticed. Customization. LUTs can be tailored for specific imaging protocols or patient populations, ensuring that images are processed in a way that maximizes diagnostic information. By utilizing LUTs effectively, technologists can significantly improve the quality of digital images, enhancing diagnostic accuracy. How do exposure factors such as milliampere seconds mass influence the outcome of a radiographic image? Answer: milliampere seconds mass is a critical exposure factor that directly affects the quality of radiographic images. Definition: mass is the product of the tube current, milliamperes, and the exposure time, seconds, determining the total quantity of X-rays produced during an exposure. Influence on image density. Higher mass results in increased image density darkness as more X-rays penetrate the patient and reach the detector. Conversely, lower mass may lead to underexposure, resulting in images that lack sufficient density for proper interpretation. Impact on noise and detail. While increasing mass can enhance image density, it also reduces quantum model noise, since more photons are available for detection. However, excessive mass can lead to overexposure, diminishing detail and increasing patient radiation dose. Optimal selection. Technologists must select mass based on the patient's size and the specific imaging protocol to achieve optimal image quality while minimizing radiation exposure. Comparing contrast resolution and spatial resolution in the context of medical imaging. Answer: contrast resolution and spatial resolution are two fundamental aspects of image quality in medical imaging. Contrast resolution. This refers to the ability of an imaging system to distinguish between different tissue densities. It is crucial for detecting subtle differences in tissue types, which aids in diagnosing conditions such as tumors. Higher contrast resolution is achieved through appropriate selection of exposure factors as well as the use of contrast agents when necessary. Spatial resolution. This denotes the system's ability to display fine details in an image. It is determined by pixel size, matrix size, and the imaging modality used. Greater spatial resolution allows for better visualization of anatomical structures, which is essential for accurate diagnosis. Interrelationship. While both resolutions are vital, they can sometimes be at odds. For instance, increasing spatial resolution, e.g., using smaller pixels, may reduce contrast resolution if not properly managed. Imaging professionals must balance these two aspects to optimize image quality for diagnostic purposes. MS Davis, a medical imaging technologist, notices unusual streaks on the digital X-ray images of a patient who was moving during the exposure. What steps should MS Davis take to address this motion artifact and improve the image quality? Answer: to address motion artifacts and improve image quality, MS Davis should take the following steps. Patient education. MS Davis should explain the importance of remaining still during the exposure to the patient. This can help prevent future occurrences of motion artifacts. Repeat imaging. If the streaks significantly compromise diagnostic quality, MS Davis should consider redoing the X-ray after ensuring that the patient is comfortable and informed about the procedure. Adjust exposure settings. If applicable, MS Davis can use shorter exposure times to minimize the effects of any potential patient movement in the future. This adjustment reduces the time available for motion to occur. Quality control. Conduct a review of the imaging equipment to ensure it is functioning correctly. This may include checking for any issues with the detector or imaging software that could contribute to artifacts. By following these steps, MS Davis can enhance the quality of the images obtained and ensure accurate diagnostic outcomes. What are the causes of artifacts in medical imaging, and how can technologists implement troubleshooting techniques to mitigate these issues? Answer: artifacts in medical imaging can arise from various sources, including motion artifacts, caused by patient movement during exposure, resulting in blurring or streaking. Grid misalignment occurs when the grid is not properly aligned with the X-ray beam, leading to banding artifacts. Detector malfunction. Problems with the imaging detector, such as pixel dropout or electronic noise, can result in uniform areas in the image. Troubleshooting techniques. Motion artifacts. To reduce motion artifacts, technologists should educate patients about the importance of remaining still and consider utilizing faster imaging techniques when possible. Grid misalignment. Technologists must ensure proper alignment and positioning of grids before conducting imaging procedures. Regular calibration and maintenance of equipment are essential to avoid misalignment. Detector issues. Implement routine quality control checks on imaging equipment to identify and resolve any detector-related issues promptly.